and thank you for joining us for this week's episode of Foot Talk. And today we're going to continue with a discussion of heel pain. Heel pain, as we know it in our practice, is the most common deformity that we see. I've been doing this for almost 30 years now, and if this was a live, interactive discussion, I would expect you to say, gosh, you don't look that old. But in any event, heel pain has a lot of misconceptions. Most people will come in and automatically either assume that they have plantar fasciitis, will have hit the web, or have had many of their friends advise them that they probably have plantar fasciitis. But I'm here to tell you that although plantar fasciitis is very common, it is far from the only diagnosis that we see with heel pain. So I have a lovely patient here who's volunteered to allow us to use her foot. And I'm just going to go through some of the basics of what we typically tend to see with adult heel pain. And there are four basic areas that we tend to find problems. The most common, as we know it, is plantar fasciitis, and that involves the overpulling of the plantar fascial ligament, which runs from the ball of your foot back to your heel. Bottom of the heel comes up around like so. And right in this general area, the plantar fascia at its attachment point gets very inflamed. We also tend to see a similar sort of phenomenon in the back of the heel, where the Achilles tendon comes down and attaches along the back margin of the heel. Oftentimes we will see spurring, inflammation, and a large bump on the back of the heel, which makes it very difficult for patients to get shoes on comfortably and makes it very sore every time the Achilles pulls in this upward direction. In addition to those two problems, we tend to see lots of folks who have tarsal tunnel syndrome. By now, everybody has heard of carpal tunnel syndrome in the hand. Tarsal tunnel is its very closely related cousin, involving an entrapment of the nerve that comes down from the inner ankle area and splits and sends branches to the bottom of the foot, roughly here and here. And those branches oftentimes will get entrapped at this site, cause burning, searing, oftentimes numbness, to the underside of the heel, and in many cases up through the arch into the toes. Last but not least, we cannot overlook the incidence of fractures in the heel. It is not uncommon at all for us to see folks who have incurred stress fractures. Each one of these deformities has a different mechanism, different presentation, and more significantly, a different treatment protocol. So I would urge you, if you're having heel pain, do not rely on social media, nor your oftentimes misinformed friends and family, and make an appointment and come on in. We've been treating this for 30 years. We have developed very significant protocols that are tailored to each patient's individual needs. So please give us a call.